Alajuelita is located on the outskirts of San Jose, the capital city of Costa Rica. In the area, there are more than 12,500 Nicaraguan immigrants who have settled to find stable work and fair-paying jobs. Unfortunately, the superior healthcare system isn't accessible to the Nicaraguan population if they are not Costa Rican citizens. Many times, these immigrants come from broken homes, backgrounds of violence or trauma, and even extreme poverty, creating a need not only for medical services, but psychological services as well. FIMRC's first project site was located in San Jose and developed out of a strategic partnership. In 2004, we began serving the Alajuelita area by opening FIMRC's first standalone clinic. Patients from nearby communities such as El Yasmin and Los Pinos would walk to see the clinic's physician, which was the only doctor in the area accessible to the population without cost. Today, we operate in the Alajuelita community of San Felipe. Our clinic sees both male and female patients of all ages. The majority of cases seen at the clinic are acute in nature and many times preventable. The most prevalent diseases are upper respiratory infections, gastrointestinal issues caused by parasitic infections, asthma, and ear, nose, and throat issues. Many of these health issues could be avoided by increasing access to potable water or adequate living situations. In a recent survey of patients, we discovered that 79% of our patients do not have access to potable water. The average number of members living in a household is 8, and 49% of patients have a dirt floor in their home. These issues only increase the risk of sickness, as is evidenced by the recurring visits by the population. Our outreach efforts at Project Alajuelita are focused on preventing many of the common problems. Health education takes place both in the patient waiting room as well as in specialized groups. In addition, FIMRC staff and volunteers give health education sessions in our partner soup kitchen to children and mothers who attend. Some of our newest community initiatives are focused around psychological care and personal well-being. In conjunction with the field operations manager and psychologist, Tatiana Blanco, the team has developed programs such as dance therapy and art therapy. Volunteers and interns have also created wellness groups that are now being sustained by staff focused on the prevention and maintenance of non-communicable diseases such as obesity, which is on the rise in the Nicaraguan population in Alajuelita. The growth and change that has occurred in the past year at Project Alajuelita has meant increased education sessions, better access to specialized campaigns and medical services, as well as increased community participation. We are so excited to see the continued development of the project site and the impact that it has had on the community.